Okay, okay. Hmm. Yes. Mm.
We say it's green.
Oh, dear.
We say it's green. Is that what you want us to say?
Ay, ay.
Oh, you want the PowerPoint? Okay.
Yes, I am. Oh boy. Ay, ay, ay.
Okay.
Okay.
Look like it's coming now.
Okay.
There you go.
Oh boy. Wonder if I had stopped recording.
It's recorded now.
It's recording now? Oh,
Yes.
okay. Okay. So I want to welcome everyone to Living Well. I am so glad that you are here today. Today we are going to be, oh boy. Today we're going to be talking about taking charge of your health. And I am not advancing. Taking charge of your health. Before we start, I'm going to just read our disclaimer. This presentation is for educational purposes only. The information shared is based on research, personal experience, and biblical scripture. Our goal is to educate you on the topic, not to assess, diagnose, prescribe, or treat any medical conditions. If you have a specific condition or situation in which you are concerned, you are encouraged to seek advice from your personal physician. Again, this is for educational purposes, and if you're in, and is intended to increase your awareness on the specific topic. So we are going to be talking about taking charge of yourself, taking charge of your health. Last week, Dr. Sankey spoke about or talked about that we are going to be discussing creation health. We're going to be talking for the next several months about the 8 laws of health. Some of you might be familiar with the acronym New Start when referring to the 8 natural laws of health. Well, instead of New Start, we will be exploring the acronym Creation, which include the 8 laws of health in a slightly different perspective. So the letter C in creation stands for choice. The Oxford Dictionary described choice as an act of selecting or making a decision when faced with two or more possibilities. So today, we are faced with two choices today regarding our health, choosing a path to a healthy lifestyle or to one that leads to an unhealthy lifestyle. Deuteronomy 30 says, I have set before you life and death, blessing and cursing. Therefore, choose life. God desires for his children to choose life. Choosing to take care of your health is a step towards choosing abundant life that God wants us to have. So today, I'm going to give you some tools, 10 tools that you can use to change your health or to take charge of your health. Our goal is to inform you so that you can transform your life. Research has shown that patients who take an active role in their health have better health outcomes than those who do not. So here are these 10 tools that we're going to talk about. First of all, know your vital signs. Very important. So what are your vital signs? Your vital signs include your blood pressure, heart rate, respiration, and temperature. Knowing these numbers and understanding what they mean can have a great impact on your health. There is a reason why these 4 measures are called vital signs, because these 4 measures are significant indicators of what is about to happen in your body or what is already happening with your body. Vital signs are objective measurements of the functioning of your body. When you visit your doctor's office, one of the first things that the nurse or nursing assistant will do, they will perform these 4 measurements. They will take your blood pressure, your heart rate, your respiration, and your temperature. So I wonder, how many of you know what your average blood pressure reading is, or your heart rate, your respiration, or even your temperature? I want to take a poll in the chat. If you know all 4 of these measurements, if you know what your basic bottom line, your baseline is, all 4 of these measurements, but 4, if you only know 3, 2, 1, or maybe you do not. I would like to see now if you can put in the chat for me what if you know what your baseline for your blood pressure, these 4 vital signs. How many of them do you actually know? Okay, I do not see anyone in the chat, but as I was saying before, this is very important. So let's take, for example, your blood pressure. Why do you need to know your blood pressure? Oh boy. So your blood pressure is not moving forward. So your blood pressure, these are 2 numbers that are recorded when measuring blood pressure. There are 2 numbers that are recorded when measuring your blood pressure. You have your systolic blood pressure and diastolic blood pressure. So the higher number, which is the systolic blood pressure, refers to the pressure inside the artery when the heart contracts and pumps the blood towards the body. The lower number, which is the diastolic, that indicates when the heart is at rest. So a normal blood pressure reading is about 120 to 80 over 80. That's a normal blood pressure reading. The important thing that we need to know is to know what your normal blood pressure is. You know, there are differences, there are different factors that can affect your blood pressure, such as age, heart condition, even a fever, dehydration, shock. All those things can affect your blood pressure. So if you do not know what your blood pressure is, I will encourage you to seek to get your doctor, to let your doctor check with your doctor so that they can tell you what your average blood sugar pressure is. Next, we have your pulse rate. So what is your pulse rate? Your pulse rate measure, the pulse rate is a measurement of the heart rate, or the number of times your heart beats per minute. As the heart pushes blood through the arteries expand and contract with the flow of blood. When checking your pulse, you're checking for beats per minute. So you see how frequent your heart beat. Besides checking for the beats per minute, it's also a good idea to check for if it's regular heartbeat, to make sure it's regular, or also you check to see how strong that pulse is. But because all of those can indicate if there's something wrong with your heart. The other one is respiration. Respiration is wonderful. So the respiration is the rate, the number of breaths you take per minute. The rate is usually regular. It needs to have an even up and down motion of the chest. A normal rate for an adult is between 12 to 16. And then we have our temperature. The normal body temperature of a person varies, depends on the gender, recent activity, food, fluid consumption, even in women, time of the menstrual cycle, they can all differ. So a normal body temperature can range from 97.8 Fahrenheit to 99 degrees Fahrenheit. For a healthy adult, So body temperature may be abnormal due to a fever. If you have a fever, it will be high. Or if you're hypothermic or your temperature is low, it will be below, according to the American Academy for Family Physician, it says hypothermia or low temperature is when it drops below 95 degrees Fahrenheit. So all those things we need to know. So if there's a change, we can let our doctor know, or we can take proactive measures so that we will not further deteriorate into a worse condition. Another thing we need to know is to make most of your doctor's visits. So when you go to the doctor, be prepared to converse with your doctor, have your facts all together, make a note of what is happening to you, because sometimes when you get to the doctor's office, you forget what some of the questions you want to ask your doctor. So make sure you talk to him about your lab work. If your doctor ordered lab work for you, ask questions. Why they're doing this lab work? What results are they hoping to find? If they're abnormal lab tests, ask the doctor about the abnormal lab tests. What can you do to improve these lab results? So you have a right to know all of these things. Do not be afraid to talk to your doctor. Also, obtain a copy of the results. Keep a copy of the results so you can compare one year to the other, one result from the other. Another thing that we need to do is pay attention to our body. Pay attention to all the aches and pains that you may be having. Do not ignore these aches and pains because they could be early warning signs for something worse to come. For example, a chest pain. Chest pain could indicate that you be having some kind of a heart condition. Burning in the chest, pain in the chest, in your epigastric area could be something with your stomach. Acid reflux, for example. All these are warning signs that you can take note of so it does not progress to something worse. So what about, look at your extremities, look at your feet. Other times, sometimes people have swelling in their feet, their legs, their ankles, and they're not sure what is going on. They ignore it, but that could be very problematic. So look for swollen ankles, swelling in your hands, your abdominal area. This can all indicate some sort of a heart failure. Poor circulation in your feet could be a blood clot that's there or more. So take note of this. Do not ignore these signs. When these things are happening, the body is saying something is wrong. I need for you to check on me. So do not ignore these signs. Get your doctor, call the doctor so that they can order further lab work or x-rays or ultrasounds or whatever. If you have heart failure, for example, watch your weight very carefully. If you weigh more than 2 pounds in one day, you need to call your doctor. You might need some extra medication like diuretics. Or if you weigh more than 5 pounds in 1 week, you need to go see your physician. Watch your sodium intake. All of these things can increase the extra fluid in your heart, in your body, and because your heart is not pumping effectively, it can cause all of this swelling and so forth in your extremities. Know your bathroom habits. You know, some of us maybe go to the bathroom every day. Some of us take a couple of days. Know your bathroom habits. If you see a change in your bathroom habits, talk to your doctor about it. So maybe then they can do further check. Because all of these things, as again, I keep saying, it can be indicative to something worse. Check the color of your urine. Very important. As you see in the second, the second line here, normal color for urine is a pale straw color or a translucent yellow. That's what you need to see when you go to the bathroom. If you see something a little darker, like the third line here with dark yellow amber, it could be you're dehydrated. You maybe need to drink some more water. Red, burnt color orange, you need to see your doctor. It could be something worse indicating, maybe some kidney issue going on. You need to see your doctor. You know, we can overhydrate ourselves and then we see just no color at all. We just need to stay within the normal range because too much of one thing could be good for nothing. If you drink too much water, you can dilute, you can cause your electrolytes to be imbalanced, and then you can have problems here. So drink water, you know, when you're thirsty or before you get thirsty, 8 glasses per day, depending on your weight, half your body weight in ounces of water, what is recommended for you to drink daily. If you're outside exercising, or you're outside, you know, working in the sun, well, you need to drink some more. You need to drink more than your 8 glasses of water. Another thing we need to do is to schedule yearly physical exams. You know, physical exams can help to detect health problems early and help you stay on top of your health. It is far better to be on the fence than to be on the defense. The annual requirement exams that pertain to your age and to your gender, you need to keep check on those. For example, for women, mammograms are important. According to the American Cancer Association, women between ages 40 to 44, they have the option to start annual mammograms. 45 to 54, they should do annual mammogram. And 55 and over, you can either have a mammogram every other year or continue with the annual screening. Also, women ages 21 and over, 20 to 30 years old, they need to have a pap smear every 3 years to detect any sort type of cancer or anything like that. And if you are a woman between age 30 to 65, you need to do a pap smear every 3 years or a pap smear and HPV every 5 years. Now, 65 years and older is no testing really is needed, but it's up to you. But if you have history of cancer or family history of cancer, I would say you need to continue checking. And for men, know what your PSA levels are or what your PSA level is. The safe level is between 0 to 2.5. A reasonable safety level is between 2.6 to 4. Anything above 4 and over is suspicious. Talk to your doctor about it. The doctor can order more frequent exams, especially Black African-American male. They need to make sure that they check their prostate PSA levels because they have a higher incidence for prostate cancer and prostate problems. Another regular exam we need to be doing is a colonoscopy. So if you're over 45 to 75, you need to be doing colonoscopies. So start at age 45 and continue every 10 years as long as there are no cancer, no sign of cancer, no cancer in your family. So you can do that up every 10 years. If you're 76 to 85, you should do screening. Should happen on a case-by-case basis. So if you are maybe have a history of colon cancer or family history, the doctor will recommend when you should do, or how frequent you should do colonoscopy. 85 years and older usually advise that is not needed. Colonoscopy is not needed after age 85. But again, it's up to your doctor, so talk to your doctor. Medical records. Keep track of your records. Keeping track, keep all your healthcare papers, like doctor notes, prescription, exam results, etc. Keep them all together in one file. Because if you want to look back on something, you know where to go for it. It's right there. You can refer to it. You can show it to your doctor. Maybe if you have a new doctor that you have to go to, you have your files ready. You can go to take them to your doctor. Also keep all your prescriptions at one pharmacy. That way your pharmacist can detect if a medication, if there's any contradiction with your medication, because sometimes you might go to a new doctor and he will order medication not knowing that you are on a certain medication that can be contraindicated to that medication. But your pharmacist can pick that up. You know, they also know your health history, your allergy history. So if a medication that the doctor ordered and there's ingredients in there that you're allergic to, that pharmacist can pick it up. So try and keep your medication all at one pharmacy. Know your pharmacy. They should be your friend. So the more you organize, the better you're going to be. No, so if you keep everything organized, your caretaker can know exactly what you need and where your medications are kept and what you are taking, and if any potential risk, everything is right there. Also, so very important, talking about medication, know the names of your medications, know the dosage of your medications. So many times I will ask someone, what medication you're taking? Oh, I'm taking a blood pressure pill. Oh, it's a blue pill. Or they do not know the name of the medications. And that is so disheartening. So know, first of all, what the medication is for. Why are you taking the medication? Know what the active ingredients of the medication is, because sometimes this medication might have, you might be allergic to it, and it might be contraindicator for another medication. So know what your ingredients is. Know how to take the medications correctly. Sometimes the doctor order medication for you to take daily. And it doesn't mean that you take it 8 o'clock today and maybe noon the next day. It does not work that way. You need to take the medication correctly. The doctor said to take it every other day. Do exactly that, because you can run into problems, especially these 24-hour medication. They are slowly releasing in your system. And when you take it too far off from the previous time you take your medication, the dose will not be effective. You need to keep it at least an hour or before or after. Around that time, you need to have like an hour earlier or hour later. I always tell people they need to have a medication in an area where they visit every morning. You visit your bathroom every morning to brush your teeth. So if you have your medication sitting right there at the counter, and after brushing your teeth, you can easily just take the medication. Develop a system so that you can take your medication all the time, at the same time. Know your allergies, let your family members know what you're allergic to, because sometimes you might be passed out and you're only your family member around, and the medics come, they can easily tell them what medications you're allergic to. As a matter of fact, there are allergy bracelets and allergy and chains that you can wear. So if you have an allergy, you need to have something indicated on you what you're allergic to. Know the side effects of your medication. Side effects of your medication, if you do not know, sometimes you are suffering from a side effect and you don't know it's a medication. So learn the side effects of your medication so that you can call the doctor, let them know, hey, I started this medication, I'm having, this is happening to me. The doctor can always change it. Get enough sleep. I know we'll be talking about this later on, but I just want to mention, get enough sleep. According to the National Health Institute, sleep deprivation increases the risk for heart disease, diabetes. It even increases insulin level. It affects your hormone, and insulin is a hormone. It can cause obesity and depression because you don't have enough sleep. The average adult needs about 7 to 8 hours of sleep per night. Sleep is important for restoration of your body. During the hour of sleep, our body repairs itself. Just like a car needs a tune-up every so often, our body needs a daily tune-up, and sleep is our daily tune-up. So get enough sleep. Another important thing we need to do to take charge of ourselves and so we can make the choice of having a healthy lifestyle is exercise. Exercise improves circulation, decrease stress, strengthen muscles, improve mental clarity. It maintains our weight. It produces endorphins so that can improve our mood. Exercise is essential to maintain a healthy life. The Office of Disease and Prevention and Health Promotion recommend 30 minutes of moderate exercise 5 days per week. This helps strengthen your muscles, increase your cardiovascular system, strengthen your cardiovascular system, I should say. Also, you need to do muscle strengthening exercise at least 2 times per week. If you cannot do a full 30 minutes of exercise, you can break it up. It doesn't have to be all 30 minutes straight. But once you get 30 minutes per day in, very important. Exercise, we need to engage in daily physical activity because, as I said, it helps with cardiovascular system. It helps strengthen your muscles, prevent you from falling and all of that, because now your muscles are stronger. It will prevent other problems. Nutrition. Cannot say enough about nutrition. You are what you eat. Eating a healthy, balanced nutritional diet is a major tool for staying healthy. You can start, I should say, by simply increasing the number of fruits and vegetables that you eat, cutting back on sweets and refined foods, drinking more water. Instead of reaching for soda, reach for a bottle of water. Because every time you reach for that soda, it's full of sugar, increase weight, cause other problems health-wise. So drink more water. Try not to snack in between meals. We want to allow our stomach to have time to rest. If you can eat 2 meals a day, even better. No more than 3. And number 10 is build a strong immune system. Building a strong immune system is important. A strong immune system helps to prevent us from flu and colds and other diseases like heart disease, diabetes, and even certain cancer. One vitamin that we need to optimize our health is vitamin D. It is noted that vitamin D, every organ in our bodies have a receptor for vitamin D. We need vitamin D, is vital. Multiple studies have shown that most Americans are vitamin D deficient. So keeping vitamin D at the optimal level it will help you build strong immune system. And if you have a strong immune system, you can fight off diseases. So what does it take to change your health? First, you must see the need for a change. If you do not see the need for a change, then you won't want to change. You must see that there's a need for change so that you can make that change. And secondly, you must be committed and stick to your plan. I like what Abraham Lincoln said, commitment is what transforms a promise into reality. So if you are not committed, then what you promise to do, what you plan to do, you will never be able to fulfill it. And thirdly, set aside time. Set aside the time that you need to implement these changes so that you can make a sure and steadfast progress towards taking charge of your health. So in conclusion, I just want to say that each one of you have a choice in determining the future of your health. No one can make that choice but you. So get control, know your vital signs. So know your vital signs, be aware of what's going on in your body, schedule regular office visits with your physician and discuss with him or her your lab results and make sure you understand the instructions that your physician is giving you. Do not forget to do regular health checkup. Health checkup is very important. Health screening. Know the names of your medication. Keep track of your records. And get adequate amount of sleep. Adequate amount of sleep is important. Find time to engage in physical exercise and eat a healthy diet. And for sure, enjoy the sun. Good health is better than wealth. We have a choice to take charge of our health. So let us do it well. Yes, you can do it. You can make that change. You can take charge of yourself. And remember, it's a choice. At this time, I'm going to open up for any questions. Let me see. Okay, any questions? Okay, no one have questions. I am glad that you are here.
I have a I don't know how to put it across, but let me just kind of say it in my own words. You know, long time people used to say when you're passing urine and the urine clear like water, that is good. But I didn't know that was something that not so good. Is it?
Well, if overhydration, where you can't even see the color, it's like nothing. It's just the same color as water, totally clear. That's what I'm talking about.
So that means you're drinking too much water.
It could mean that you're drinking too much water. It could mean that, yeah. Yeah, but water is important.
Yes.
Although water is important, we must not overdo it. Yeah.
Okay.
Yeah. I have a specific, okay. Oh, this is, okay. Okay, thanks for that question, Alicia. Okay, I know Dr. Sankin and I have been talking about giving each and every one of you a gift. So I think in the message she sent here is that I guess she will, if you would like to receive a gift, to email her at jenCooper@embarkmail.com. Okay. And Lee, thanks for that. Your blood pressure, that's good, 124/80 and pulse of 66. People who exercise, people who are athletes, they usually have a lower blood pressure, heart rate, and also blood pressure. And that's fine, that's quite normal for them because their heart is pumping stronger and slower, and they are fine. Some of us, if our heart rate drops too low, then we get dizzy. Our blood pressure dropped too low, below 100, we can get dizzy. So look out for those signs of dizziness. It could be because of a low blood pressure. Okay, so I hope this message today kind of give you all an insight of what you need to look for, things that you need to do to improve your health, because it is so very important to know your numbers. If anything goes wrong, you can easily say, no, that's something is going on in my body. I need to check something. I need to stop and do something. Because I know when I go to the doctor and if my blood pressure is over 110, I'm concerned because my blood pressure is always below 110. So things can raise your blood pressure up, because if you're rushing into your doctor's office and they go ahead and call you in and take your blood pressure right then it might be a bit high. So it's a good thing to relax a bit, maybe about 5 minutes. See if you can calm down. Tell the doctor, wait, I just want to calm down a bit before you take my blood pressure. And calm down, take nice, slow, deep breaths, inhale, exhale to calm yourself down before taking your blood pressure.
Emily, can you put Dr. Sankant's email address in the chat? Because I didn't catch it.
Oh, okay, sure. Sure, I can do that. I'm going to copy it out here and okay, I just put it in the chat again. Did you see it? Did you see it, Dee Dee? Okay, at this time, we're going to stop recording and we're going to open up for a prayer request.